Hello and a warm welcome to MSK Rad videos. This is the first in a series of short tutorials on cervical spine trauma. If you haven't watched the previous two videos, which were looking at thoracolumbar trauma, it's probably worth watching those first because I deal with some basic principles about how bone fails depending on the force that's applied to it. And it's also worth heading over to mskradvideos.com where you can actually look at these cases yourself on a PACS viewer. And it may be worth doing that before you actually watch the video and decide what you think the cases show. You don't need to sign in. There's no credit card or payment. Everything is freely available on the website. So let's kick off with the first case. Okay, just to briefly recap on the basic principles about how bone fails depending on the force that's applied to it. If you apply a compressive force to a bone, you'll get a longitudinal fracture which runs down through the spine, whereas if you pull apart the bony structures, you'll get a horizontally orientated fracture. So let's look at this first case and we'll just walk through it and try and decide. I'll just direct your eye to this area here. I think it's pretty obvious where the fracture is, but try and decide in your own mind what force has been applied to cause this fracture. Okay, so I think it's pretty clear that this is a longitudinal fracture line, and you can see it's quite clear that the fracture is running from one facet joint to the other facet joint up through the spine longitudinally. Don't be fooled by this sort of appearance as it comes up just onto the facet joint here. You can almost see it looking like a little bit of or maybe a horizontal line here, but in fact, if you follow it down, it goes longitudinally down through the spine. So what this means is that there's been a force applied through the back of the spine. And in the cervical spine, this means that there's been hyperextension. So then we're looking for a distraction injury at the front of the spine. We're looking for linear flakes of bone that have come off, and here it is. Here's the linear avulsion here, just at this site here. And the other thing you'll notice, of course, is that there's marked soft tissue swelling, which is a very common feature with a hyperextension injury. So having seen this, we can now go to the MR, and it's going to make it so much easier for us to work out exactly what's going on in the MR. So firstly, as we come on the parasagittal sections just adjacent to the facet joints, I'm going to keep stressing how important these parasagittal stir sequences are, because when you have a flexion injury and you pull apart the facet joints, you get an awful lot of edema around the facet joints spilling out into the soft tissues. When you compress the bone and you get fractures, you get some edema, but it's much less marked. So this is the sort of edema that you expect with a compressive force here. And of course, it's quite difficult to see the hyperextension injury here, which is going through just into the anterior fibers of the disc, but we know it's there because we've actually seen the bony fragment. And that explains why we've got cord injury, because this is a hyperextension fracture dislocation. So all of this part of the spine was driven backwards at the time of injury. The cleavage plane goes through the anterior aspect of the disc. The posterior longitudinal ligament is intact, and it causes this cord injury here. So that's a hyperextension fracture dislocation. Okay, let's look at the second case. Again, just decide what you think the injury pattern is here. And again, I'm going to draw your eye to this area down here. In fact, I'll make it larger. And I think you can already see that there's a longitudinal line. There's one line running down here. There's one running across the pars interarticularis here, running straight down. And again, there's a longitudinal fracture here. Now I notice there's a little flake of bone here. I'm going to describe the orientation of fracture lines with fragments of bone at the front of the spine. And generally speaking, I've already said that horizontally orientated fracture lines are generally what occurs with a distraction force. And a flexion teardrop has more of a longitudinal orientation. So this looks like it's got more of a longitudinal orientation. So you might be thinking, perhaps this is a flexion injury. What you have to think is, what position would the spine have been in if this was going to have been a flexion injury? This would have to have driven all the way down here. There aren't any osteophytes. It's an awful long way for this bit of bone here to come down and push that off. What's much more likely, of course, is that it's just a tiny flake that's pulled off from the anterior longitudinal ligament. And we've got this clear evidence here of a compressive injury through the back. So again, this is a hyperextension injury. So let's look at the MR of this case. And firstly, just on the parasagittal, I've got some edema, but not really marked edema that you would get with a flexion injury. And I've got the edema around here where the fractures are around at the back of the spine. You might look at this and think, well, this looks like to me that the ligamentum flavum has been ruptured at this point. What you have to appreciate is, going back to the CT, of course, that the fracture line has come down and it's actually involved the front of the lamina, of course, and the ligamentum flavum is running all the way up here. So it's not that it's pulled off and disrupted the ligamentum flavum by distraction. It's simply that the compressive effect has cleaved off the attachment of the ligamentum flavum. So it's a bony injury just at the site where the attachment. Now, this is a hyperextension injury. And what we see is, in fact, there's cleavage higher up here at 4-5, which perhaps we weren't suspecting. And again, we've got marked, we've got cord edema, we've got narrowing of the canal. All this part of the spine has been driven backwards, causing this cord injury. So if we go back to the CT, could we see that? Well, not really. We can understand why the cord was injured, because it was a very narrow canal, lots of osteophytes. So it's not surprising, but the cleavage plane is actually here. So the compressive force back here, hyperextension injury, and it just emphasizes the point, really, that you can get injury at more than one level in the cervical spine. Okay, let's move on to case 3. And see what you think of this. I'll just zoom this up. And I think if you've looked at these cases already on the website, you'll be at an advantage here, because this is quite a difficult case. Okay, so there it is. There's the fracture of the facet joint. It doesn't look very much, but this is a horizontally orientated fracture through a facet joint. And a horizontal orientated fracture through a facet joint is always significant. It is evidence of a flexion injury. What you have to imagine is, how did that fracture actually occur? What position was the spine in at the point where the fracture occurred? You can imagine that this facet joint drove up and then pushed forward, breaking this little portion here. So any horizontally orientated fracture through the facet joint, even little tiny avulsions, capsular avulsions around the facet joint, are very significant, because they're evidence of a flexion injury. And the other sign of an injury here was a compression fracture just here, longitudinally through the anterior aspect of the vertebral body. So now let's go to the MR in this case. And Firstly, massive amounts of edema around the facet joints spilling out into the soft tissues. And this is a flexion, fracture, dislocation. Again, massive amounts of edema with complete disruption all the way across the posterior ligaments, straight through the disc. You can see the high signal in the disc, the fluid in the disc. This is disc rupture going all the way through. In fact, the spine has displaced somewhat since the CT scan. So this is the most unstable form of injury because nothing is connecting this portion of the spine to this portion of the spine. So the take-home message for this case is that no matter how small fractures of the facet joints, if they are horizontally orientated, they are very significant because they're caused by flexion injuries. Longitudinal fracture lines, which often run from one facet joint to the other, are evidence of hyperextension injuries, which can cause cord injury at the time that the injury occurs, but they're less unstable than the flexion injuries. They're unstable in hyperextension, but there's less of the risk of the head and cervical spine falling off anteriorly. Okay, so I think that's enough for today. If you enjoyed that, please do like and subscribe, which gives me the encouragement to continue sharing these cases with you. And I'll see you next time. Goodbye.